Welcome to our class on breastfeeding. To start out, we would like to acknowledge that we know and understand that breastfeeding is not necessarily for everyone. If you have already decided that the best decision for you is to formula feed your baby, please know this is a perfectly safe and healthy way to feed baby. This class is meant to provide additional education about the benefits and the basics of breastfeeding for those that are unsure of how they would like to feed their baby or would like more information about it. In this class, we will discuss the benefits of breastfeeding, review some of the basics, discuss latching and positioning overview, review how to know whether baby is getting enough, and discuss some common breastfeeding problems. Benefits of breastfeeding. Breast milk is the most physiologic way to feed our babies. It is designed with the right balance of fat, carbs, water, and protein to help baby have the best optimal growth and development. Breast milk is easy for babies to digest, and the composition of breast milk changes over time to match baby's nutritional needs. You can see here in this photo that the initial breast milk is thick and yellow in color and called colostrum. This milk is low in volume but high in calories as baby's stomach is small and helps baby get exactly what they need in those first few days of life. Over time, the breast milk changes to transitional milk and then mature milk to match baby's needs for how old they are. First, let's review some of the benefits for baby. Babies benefit from the intimacy itself of direct feeding. It helps baby with their development and their social skills. Babies have an immature immune system. Having access to breast milk helps improve their immune system because they receive all of the antibodies from mom. Anything that mom has been exposed to and is immune to will help baby be protected against this disease as well. This leads to reduced ear infections, reduced diarrhea, and less chance of pneumonia for baby. Babies also have a reduced risk of some chronic illnesses over time. This includes asthma, eczema, diabetes, leukemia, and risk of SIDS or sudden infant death syndrome. Babies who are breastfed tend to have higher IQs, improved brain maturity, and over time, reduced incidence of obesity. Breastfeeding has many benefits for mom as well. Moms who breastfeed have a decreased risk of breast, ovarian, and endometrial cancer over time. Additionally, breastfeeding moms have reduced risk of common cardiovascular diseases. This includes diabetes, stroke, heart attacks, high cholesterol, and high blood pressure. Finally, moms who breastfeed find it easier to lose weight. This leads to moms being able to return to their pre-pregnancy weight sooner. Breastfeeding basics. Let's review the current recommendations by the World Health Organization. WHO recommends initiation of breastfeeding within 1 hour of birth. Many hospitals are baby-friendly and help promote this initiation of breastfeeding by skin to skin right after baby is born. The next recommendation is exclusive breastfeeding for the first 6 months of life. This means no other forms of nutrition aside from breastfeeding until 6 months. Remember that all breastfed babies need vitamin D supplementation, and if babies are preterm, they also should be receiving iron supplementation. The final recommendation is to continue breastfeeding through 2 years. After introducing complementary foods, we should continue to be offering baby breast milk through age 2 and beyond. We definitely know that continuing to breastfeed until age 2 is not for everyone, and any amount of breastfeeding is more beneficial than none, but this is the recommendation by the WHO. Please note that there are some rare conditions where breastfeeding is not recommended. Be sure to talk to your doctor about your specific circumstances if you have any questions. We know that there are a lot of reasons why moms may decide not to breastfeed. Even moms who want to breastfeed may have barriers to do so. Some of these barriers include convenience. Sometimes it can be inconvenient because mom is unable to have others feed her baby as much as she would like. Moms may find that they have lack of support from family members and friends. If a mother's mother or sisters or other family members did not breastfeed, they may find that those family members don't support them in their desire to breastfeed. Unfortunately, some moms may also experience some embarrassment over feeding in public places. Moms who have breastfed before may have had problems, and this may lead to a fear of breastfeeding again. Some of these problems could include things like pain, low supply, oversupply, recurrent mastitis, etc. Lastly, moms who intend to go back to work may find that their jobs are not very supportive and do not provide appropriate accommodations to allow them to pump and continue breastfeeding their baby. If you are considering breastfeeding your baby, this is an amazing choice and we want to congratulate you. We definitely encourage you to talk to your doctor about any concerns or questions you may have. Oftentimes there are breastfeeding classes that are available both pre and postnatally. If you are a mom who has breastfed before and had specific problems, this is a great reason to see a lactation specialist before baby is born to troubleshoot those problems so that you do not have them again in the future. Although natural, we know that breastfeeding is not always easy. Please keep in mind that many breastfeeding problems are common, and they often can be troubleshooted and made better with the appropriate provider. Breastfeeding should be able to be made easier, comfortable, and manageable. Let's review how to get off to a great start with breastfeeding. Immediate skin to skin is one of the most important things you can do right after baby is born. Most hospitals encourage this immediately following delivery, unless baby is not doing well or needs some additional support. Our goal is to help baby latch within the first hour, and having baby skin to skin helps encourage that latch. Frequent feeding is crucial to establishing a healthy milk production. Learn to pick up on baby's feeding cues and then directly feed anytime baby gives a cue. Avoid pacifiers if possible. The main reason for this is that while your milk is still coming in and you are working on establishing a good feeding routine, you want to be sure that you're able to tell when baby wants to feed. Sometimes pacifiers can make it hard to know if baby is showing some of those early feeding cues, and sometimes if waiting too long, babies who are distressed are harder to get to latch. I also would recommend considering seeing a lactation consultant in the hospital, as they can help review some of the basics and make sure that baby is latching appropriately. Next, we will review how to know whether baby is latching appropriately. Latching is the term that we use for the infant being attached to the breast. This is the most important factor to prevent early feeding problems. A good latch should be comfortable for mom and baby. If the latch is extremely painful, baby is probably not latching appropriately. There are many strategies to help achieve a good latch. Oftentimes people will help you with this in the hospital, but if having problems afterwards, you can also talk with somebody in the office. These are some of the signs of a good latch. Many people think that babies should latch just on the nipple as if they were feeding from a bottle. However, a good latch is when baby is able to attach onto a good portion of breast tissue. This means that baby's mouth is open wide, baby's lower lip is curled outward and the upper lip is relaxed, the nose and the chin are in contact with the breast, baby has a relaxed suck, swallow, and breathe, and there are not a lot of other noises, such as gasping or clicking. These are some examples of a good latch. In all of these photos, you can see that baby's mouth is open wide, so that baby is taking in a good portion of breast tissue. Baby's lips are flanged outward to allow them to take in this tissue. The nose and the chin of all of these babies are in contact with the breast, and the baby is relaxed for a good suck and swallow routine. These are some examples of options for positioning your baby for breastfeeding. Sometimes it's important to try a few positions to find one that works the best for you and your baby. A few that I would like to highlight include the laid back nursing position, as this is often the position that baby's first latch will be in when doing skin to skin. I would also like to highlight the football hold and the side lying position, which help avoid baby putting pressure on the belly, which might be more comfortable if you've had a C-section. A very common question that we get is how to know if baby is getting enough if they are breastfeeding. In the first few days, babies should nurse every 2 to 3 hours. They should be having about 2 stools a day, although more is always okay, and about 2 to 3 voids in a day. A good rule of thumb is that babies should void about how many times they are days old, so a baby who is 2 days old should void at least twice. Babies who are having good intake should appear content in between feeds. Babies who are frantic in between feeds may not be getting enough. Moms also will notice that their breasts start to feel heavier, which is a good sign that their milk is coming in. After those first few days, you may notice that baby's stool starts to transition from a dark and sticky stool to more yellow and seedy, almost like a mustard color. This is a good sign, as this means that babies typically are taking in a lot of milk. Babies should have continued good wet diapers. An important thing to note is that although plenty of stools and voids is a really good indicator that baby's adequately hydrated and often means that they're getting enough, it doesn't always mean that it's enough for them to gain weight. So the most important thing is reassuring weight gain. This is why babies should be brought into the office sometimes pretty frequently in those first couple weeks to make sure they're gaining weight. Let's review some common breastfeeding problems. The following are very common problems that moms who are breastfeeding may experience. The first is nipple or breast pain, itching or burning, which could be a sign of a bad latch or could be a sort of infection or irritation of the skin, which might be able to be troubleshooted with creams. The next is engorgement. Engorgement typically happens shortly after leaving the hospital when the milk is coming in and the breasts become a lot more swollen. This can be really uncomfortable and can make it difficult for the baby to latch because the breast is too taut for baby to take in enough breast tissue with that latch. One way to help with engorgement is to learn how to hand express just a couple mLs of milk in order to release some of the tension of the breast so that baby can latch. If you would like help knowing how to do this, feel free to ask your doctor. Plugged ducts or overproduction can lead to things like mastitis, and this could also be a common breastfeeding problem. Lastly, a painful or problematic latch, which is something that can be troubleshooted with the appropriate provider. If you're having a fever, extreme pain, breast redness, or a plugged duct that doesn't get better within 48 hours, this could be a sign of an infection or an abscess and definitely warrants calling the office to be seen. If you have any other concerns, always feel free to call. An additional reason that you should definitely come in is if you have any concern that baby is not gaining enough, as we can always do a weight check to help make sure that baby's breastfeeding is adequate. Let's review a few take-home points. Breastfeeding is the most natural and healthy way to feed baby and has many benefits for both mom and baby. Some of the goals that we have for breastfeeding include getting baby to latch within that first hour, exclusive breastfeeding for 6 months, and continued breastfeeding through 2 years. Feeding early and often and establishing a good latch is the best way to have a good milk supply. Bringing baby in for weight checks is the best way to confirm that baby is having adequate intake. And finally, there are many common breastfeeding problems. However, having a breastfeeding problem doesn't mean that you can't keep breastfeeding, as there are often easy ways to address and fix these problems. Never hesitate to call the office. We welcome any questions, concerns, or shared experiences at this time.